Okay, so a very good evening to all the respected listeners. Today we are going to discuss the different methods of blood sample collection. Now, this is a very vital topic, as we all know that in order to diagnose any clinical condition, the first investigation which a physician order is CBC, that is complete blood count. Not only CBC, in fact, all kind of serum investigation, be it anything, they all require the blood sampling and blood sampling methods we are going to discuss. This is important from physiology point of view as well as from the clinical medicine point of view. So let's quickly start with this topic without any delay. So there are different methods of blood sample collection. As we all know that the blood is confined within the cardiovascular system, the skin has to be punctured before the blood can be obtained. So there are two common sources of blood for the routine laboratory test. One is the blood from a superficial vein by puncturing it with needle and syringe, and the other from the skin capillaries by skin prick. So arterial blood and blood from cardiac chambers may be required for special tests, but none of these samples can be called as a representative sample because there are minor variations in their composition. But for the routine hematological test, however, these differences can be safely ignored. Now, when you are just collecting a blood sample, you have to take all kind of aseptic precautions like the sterilization of the equipment, cleaning or sterilization of the skin, and prevention of any contamination. So the skin prick or the capillary blood, whenever you are drawing, has to be done under the aseptic precautions. Now, blood sample collection method, there are three different types of blood collection methods. You can see the capillary blood you can take the venous blood, you can take the arterial blood, depending upon the requirement and the sources. Like for the capillary blood, the skin and other tissues are very much richly supplied with capillaries. So when a drop or a few drops of blood are required as for the estimation of hemoglobin cell counts, BT-CT, blood films, microchemical test, and blood from a skin puncture, skin prick with a lancet or needle is adequate. Capillary blood is also called peripheral blood as it comes out of the peripheral vessels or the capillaries in contrast to the venous blood. Okay, so in adults and older children, capillary blood is generally obtained from skin puncture, which is made on the tip of the middle or the ring finger or the lobe of the ear. In infants and young children in whom the fingers are too small for a prick, the medial or lateral side of the pad of the big toe or a heel is used. So the site for skin prick should be clean and it should be free from edema, infection, skin disease, callus, or any kind of a circulatory defect. Right? So we'll just summarize it that you can either use a finger prick or a earlobe prick or a heel prick in case you want a capillary blood. Now, for venous blood, when large quantities, say a few milliliters of that blood cannot be obtained from a skin puncture, that is needed. So, as for a complete hematological and biochemical investigation, the venous blood is obtained with the help of a syringe and a needle, which you might have seen that the people come for blood sampling. This is the most usual way by puncturing a superficial vein. So, in infants, the venous blood may have to be taken from the femoral vein or from the frontal venous sinus, and venous blood is always preferred for the clinical test. One thing has to be kept in mind. Now, arterial blood, when the arterial blood is needed for special tests such as blood pH, like the ABG analysis, gas levels, etc., an artery such as radial or femoral is punctured with a syringe and a needle, and this is, however, not a routine procedure. So capillary blood, the source is either a finger prick or a earlobe prick and a heel prick. For venous blood, it is either the antecubital vein prick and pricking the veins of the dorsum of the hand. And arterial blood, it is the radial artery puncture and the ulnar artery puncture. Now, once the blood has been collected, it has to be put in certain containers for a blood sample. So a container is a receptacle into which the blood is transferred from the syringe before sending it to the laboratory. So clean and dry 10 ml glass test tubes, collection bottles such as clean and dry 10 ml discarded medicine vials, glass bulbs, etc. are usual ones in use. So container may or may not contain any anticoagulant depending on whether the sample of blood or plasma or serum is required. For example, for the sample of the whole blood or plasma, the blood is first transferred to a container containing a suitable anticoagulant. This is to prevent the clotting of the blood. Okay, but for a sample of serum, no anticoagulant is used. The blood is allowed to clot in the container and the serum is collected as described. Obviously, capillary blood does not require a container or an anticoagulant. Okay. Now, collection of a capillary blood is by a skin prick method. So, a single bold prick is given on a finger under aseptic condition. So, you never have to squeeze the pricked finger, as this will expel the tissue fluid along with blood to come out of the puncture site. The dilution of blood will thus nullify the result. Hence, for clinical work, venous blood is always preferred. Skin prick may be used on the bedside of the patient or in an emergency when it is not convenient to take a venous sample. Now, the most important thing which you have to keep in mind is that the thumb and little finger are never to be pricked, because the underlying palmar fascia or the venous bursa from these digits are continuous with those of the forearms. Any accidental injury to these fascia may cause the infection to spread into the forearm. This finger prick is given to the on the distal digit on the palmar surface of the third or fourth finger. So to remember that one deep puncture will give you free flowing blood, and it is less painful than 3 or 4 superficial pricks. This point has to be kept in mind. Now, the anticoagulants which are commonly used are heparin. Heparin is used in case of blood gas analysis and osmotic fragility test. EDTA. EDTA is a routine hematological studies, except the coagulation study we use ethylene diamine tetraacetic acid, EDTA, which is very common, and sodium citrate for blood coagulation study, PT and PTT. Sodium fluoride for blood glucose analysis in case of biochemistry, and double oxalate in PCV and ESR determination. So anticoagulant plays a very important role. Now, collection of capillary blood, I told you the important things. Now, important thing is that for a capillary blood, that you don't have to squeeze or press the finger, as the tissue fluid is squeezed out, it will dilute the blood and it will false low values. So squeeze also tends to close the wound edges, and you may exert a slight tension on either side of the puncture with your thumbs in order to open up the wound more widely. So a plug of epithelial cells tends to block the puncture, especially if the wound is shallow, as often happens with a narrow bore injection needle is used. So the forearm of the hand may be squeezed or milled towards the finger to facilitate the blood flow. If all efforts fail, a fresh prick may be required. Now, in case of a finger prick, the BT and CT gives better result at the finger prick. And when you are talking about the pricking the heel, like in infants and young children, the blood can be collected from the cleaned and warmed medial or lateral areas of the heel of the infant. So the central plantar and posterior curvature areas of the heel should be avoided, as the prick may cause injury to the underlying tarsal bones which lie near the surface. So in case of PICU, one has to be very much alert that you have to avoid the pricking in the central plantar and posterior curvature areas of the heel, because it will be avoided, as the prick may cause the injury to the underlying tarsal bones. Right now, earlobe prick with the use of sterile needle or corner edge of a sterile blade, it gives a 2 mm deep prick. The skin here is usually thinner than the fingertip, so wipe away the first drop and allow a new one to form. Now, for pricking the heel, also do not squeeze or press the finger to increase the blood flow from the spin prick, though the arm of the hand may be milled towards the finger. Now, in case of collection of venous blood, as I have already told you that uh, for blood sample from a vein must be collected by a medically qualified staff member who should screen the volunteer for any communicable diseases, especially the viral hepatitis and AIDS. Do not touch the blood and other than your own. Okay, and puncturing a vein and withdrawing blood from it needs assistance and a complete aseptic precautions. So, whenever a patient you will find with hepatitis or AIDS, it's always important to mention universal precaution while pricking the finger. The staff has to wear double gloves, and he has to avoid any touching or any contact with the blood of that patient. Now, the following samples are not suitable for the hematological tests, like the clotted samples. Even the tiny clots in the anticoagulated blood can negate the results. And hemolyzed samples, the red cells may be damaged and ruptured during the collection or handling of the blood. So the released hemoglobin tinges the plasma or the serum red, rendering the sample unfit for the test. So for a sample of a whole blood or a plasma, plasma is the blood minus all the blood cells. So draw the blood from a vein as described and transfer it from the syringe to the container which is containing a suitable anticoagulant. You have to mix the contents well without frothing, and a sample of whole blood is now ready for the test. So plasma which is desired is centrifuge the anticoagulated blood for 20 to 30 minutes at RPM of 2500, and collect the supernatant plasma with a pipette and transfer it to another container. The packed RBCs will be left behind. So this is for the sample of whole blood or plasma. But if you want a sample of a serum, serum is what? Serum is plasma minus fibrinogen and all the other clotting factors. And plasma is what? Plasma is blood minus all the blood cells. So serum transfer, for serum, transfer the blood from syringe to a container which should not contain any anticoagulant, okay, in it, and it should be kept undisturbed. After the blood has clotted in an hour or two, the clot shrunk in size, the serum will be expressed. So remove the supernatant serum with a pipette and transfer it to the centrifuge tube. Centrifuge is to remove whatever red cells may be present. So clear serum can be collected with another pipette. So what could be the apparatus that is required for collection of blood sample? You require a disposable gloves. You require sterile disposable one-time use 10 ml syringe with a side nozzle, 10 ml test tubes or vials with or without anticoagulant, sterile gauze pieces moist with 70% alcohol or methylated spirit, and a tourniquet, which is a 2 to 3 centimeter wide elastic bandage with Velcro strips to keep it securely in place and can be used. An inflated BP cuff can also be used in place of a tourniquet. So, as you can see, I will just summarize the indications of the various kind of the blood, like the capillary blood, venous blood, and arterial blood. Capillary blood is used in bedside glucose or RBS monitoring for the estimation of bleeding time and clotting time, and blood grouping and RH typing. And venous blood, as you know, in investigations like CBC, lipid profile, LFT, RFT, all the routine investigations which are used in clinical medicine, venous blood gas analysis and blood transfusion. Arterial blood can be used for arterial blood gas analysis, we call it AVG, and the toxic analysis, and for the sleep studies and for the metabolic acidosis. So this was all about the different methods of blood sample connection. Hope you like the information which I have described. Thank you so much.